Hello everyone, my name is Ainur Kagarmanova, and today I'm happy to present to you the study entitled Palliative Care in Uganda, Quantitative Descriptive Study of Key Palliative Care Indicators in 2018 to 2020. First of all, I would like to thank these organizations for making this research project possible. They are Palliative Care Association of Uganda, Center for Hospice Care Hospice Foundation, University of Notre Dame, and Uganda Martyrs University. Back in 2015, these organizations piloted the health surveillance survey to collect data on key palliative care indicators. That data has not been analyzed to date, and national morphine distribution data and accreditation data have not been analyzed together to show more comprehensive picture of the national status of palliative care services in the country. And therefore, the aims of this study are to describe the palliative care situation in Uganda, provide an in-depth analysis of key palliative care indicators on the regional and national levels, and to offer maps visualizing geographic distribution of accredited palliative care services. In order to achieve those goals, we conducted a descriptive quantitative study of available data. Using ArcGIS software, we created maps using the accredited facilities data, morphine, and population data. Then, using the SPSS software, we ran descriptive statistical analysis and non-parametric tests on morphine accreditation and mHealth data. Here you can see the data sources we used for our analysis. The indicators analyzed at national level were number of accredited palliative care facilities, number of facilities that received morphine, volume of morphine distribution, and population coverage with palliative care services. We also analyzed 2 years worth of data from 19 health surveillance survey facilities. The data points for that included number of patients, number of healthcare workers, volume of morphine received and used, challenges in accessing morphine and services provision, and the services offered by facilities. Our first finding was that the majority of palliative care services are offered at public facilities across all regions of Uganda, as you can see on this table. Here on this map, you can see the location of private and public facilities. Private facilities are shown as pink dots, while public facilities are shown as black stars. The more palliative care facilities are present in a district, the darker is its color. So in white, you can see 30 districts that have no palliative care service facilities. On this map, you can see the same palliative care facilities distribution on a population density map of Uganda. The darker is the color, the higher is the population density in this district. We used the latest available census data from 2014. 88.5% of the people live in a district with at least one palliative care facility available. Even though this number may seem high, the access to the services may be hindered by transportation challenges and high medical costs. On this map, the facilities that received morphine are shown in red, and there were 75 of them, and the facilities that did not receive morphine are shown in green, and there were 150 of them in 2019. This slide is based on the analysis of national morphine distribution data. To give a little background, green morphine is less concentrated than red morphine and therefore is cheaper, and national medical stores, or NMS, serve public facilities, while joint medical stores, or JMS, serve private facilities. You can see on the table that JMS delivers more morphine and NMS does not deliver any red morphine at all. On the chart below, you can see that the inverse relationship. When JMS orders were on the rise, NMS orders decreased and vice versa. This may suggest that NMS and JMS compete for the limited amount of morphine available on the market. Another limiting factor could be the amount of morphine powder imported into the country, but of course, further research is needed to investigate this. Now I would like to proceed in to discussing mHealth survey data. And just to remind you, the mHealth survey data is collected at 19 facilities that represent 16 districts and 10 subregions of Uganda. The average reporting is 16 months out of 24. All 19 facilities reported experiencing issues with receiving morphine. The most common ones were supplier stock out, issues with delivery or pickup of morphine, and planning timely ordering of morphine. Palliative care accredited facilities offer 6 types of services: outreach, home visits, psychosocial, legal, bereavement, and spiritual support. Of them, 4 psychosocial, bereavement, spiritual support, and home visits appear to be most likely to be available in public and private facilities. All 6 of those services are on average available 7 months out of the year due to lack of facilitation and transportation. Here you can see some general demographic information from the 19 mHealth survey facilities. On average, private facilities served more patients, experienced higher mortality rates, and had more healthcare workers. Cancer was the top diagnosis of the patients seen, followed by other conditions and HIV/AIDS. The most common cancer types were sarcomas, lymphomas, and gynecological cancers. And the most common other conditions were hypertension, arthritis, congestive cardiac failure, and pains. There are a few limitations to the study. First of all, the number of months reported in mHealth surveillance survey varied from 5 to 26, which may hinder the generalizability of the study. Then self-report survey introduces a possibility of a human error, and GIS mapping does not reflect accessibility of palliative care services. Future research may be around conducting analysis of geographic barriers to palliative care services and estimate palliative care services travel times by incorporating roads, land cover, and slope through the use of GIS. And future research may also include surveying accredited facilities that currently are not receiving morphine to see what challenges they are facing as well. So to conclude, the key messages of this presentation are following. 30 districts without palliative care services were identified and are recommended for a targeted intervention. Cancer drives patients in palliative care more than HIV/AIDS, and other non-communicable diseases are also a rising issue in Uganda. Some facilities may need help with filling out mHealth surveillance survey on a regular basis to improve the quality of the data collected, and HIV/AIDS facilities with palliative care integrated in routine healthcare are not represented in mHealth survey and are also recommended for inclusion. Thank you. At the end, I would like to thank once again all of our collaborators. And if you have any questions, comments, or concerns, please do not hesitate to send us an email. The emails indicated on this last slide.